Doctors need to talk about recovery more. Any type of medical place needs to talk about recovery more. Recovery is not talked about enough. I just had surgery, a hamstring repair surgery, where they put 3 anchors on my pelvic bone and they had to pull my hamstring muscle back on and attach it to the pelvic bone, meaning I cannot sit on my right butt cheek. It is very hard. It is not talked about enough. Recovery is not talked about enough. How to function with recovery during a surgical procedure. Maybe we should bring this to attention more. I'm not trying to point fingers towards surgeons exactly. I'm sorry it came out that way. But in the medical field, or anything like that in regards to nurses, physical therapists, whoever it may be, I believe, and I've had a lot of surgeries, and every surgery I've had, they really haven't talked about recovery and what it consists of and how to help make it easier and functional. Because if there was more knowledge on this, I think people would have a successful recovery and not struggle so much. Because even the littlest things can be the hardest things. Granted, it's minute, that my injury, but there are other severe surgeries and disabilities and other things, and it's not easy. I just wish we had more topics on this, discussions on this, like life hacks on this regarding this topic. Because, for instance, when I got out of surgery and they were dismissing me, the only thing they talked about was make sure your wound stays clean. Okay, risk of infection. Well, what should I watch out for? They didn't go over that. So I had to call them. That was a struggle, just to getting to talk about that. Also, going to the bathroom with an incision in your private regions. That's a struggle. And we don't talk about what can we do. They did not discuss that either. Okay, what about icing? Certain places want you to ice, don't ice, heat, no heat, drugs, vitamins. What can help? What can make it worse? What can benefit? A general idea of functional recovery process. And, you have to move. You have to get up and moving so you don't get blood clots. You don't want to stay in bed. But it does depend on your surgery and the procedure. And I get that. I do understand that 100%. And I know it's not the surgeon's job. But I think there comes a time when doctors, physical therapists, nurses aid, what have you, all of them, let's just get a team together and let's put this out there. Let's make things a little bit easier. And here's a list of ideas that might benefit you. It's just a paperwork. I know it's busy work, but just a list. Okay, instead of using your crutches going up the stairs, why don't you sit on the stairs and go up them, using your upper body and lifting your way up the stairs, okay? Or getting in the car. I have to have a whole bunch of pillows and blankets around me. That's another suggestion. Or even, like I said, the bathroom. The bathroom is the biggest problem that I come to find. I can't go to the bathroom. I have to use a woman's funnel. It's interesting. It is a funnel for women, and you can travel with it and you can go to the bathroom standing up. No one mentioned this to me. I just kind of researched it on my own. And like for a BBL or any type of surgery down there, that might be beneficial for women out there to get a funnel. And those can be used in camping and traveling or anything like that. They can still be used for everyday essentials. I do think it's an important topic, recovery on surgery, so you can get your best outcome 100%. And eating healthy, and there's not enough topic talking about that. You need to eat healthy, lose the sodium, lose the fast food. Like, seriously, when I was getting discharged, the person next to me, they were gonna go get McDonald's after their surgery, which was a more intense surgery than mine. I don't think that's the best idea. I'm sorry. To me, that's a high sodium that you don't need in your body right now. Go eat a salad. Go eat something light because of the anesthesia and all the other drugs going through your body. I think that's an important thing to talk about and to discuss. But that's just me. That's just an idea. That's just what I'm experiencing from this surgery. That's just my 2 cents. Who knows? Maybe it'll happen. But it's just an opinion. It's just a thought. I'm not trying to point fingers. I'm not trying to put blame onto anybody. I just want it out there in the world to make things a little bit easier because life is hard enough.